A cardiac arrest is a medical emergency that occurs when the heart suddenly stops functioning, often as a result of an electrical malfunction in the heart known as arrhythmia. This can cause the heart to stop pumping blood effectively, leading to a lack of oxygen and nutrients being delivered to the body's vital organs. In this video, we will go into more details about this event and the difference between cardiac arrest versus a heart attack. Let's get into it. Cardiac arrests can be deadly because they often occur without warning and can lead to rapid deterioration of the body's vital functions. In some cases, a cardiac arrest can be reversible if it is treated quickly, but this is not always the case. The symptoms of a cardiac arrest may include sudden loss of consciousness, no pulse or weak pulse, no breathing or difficulty breathing, chest pain or discomfort, dizziness or lightheadedness. If you suspect that someone is experiencing a cardiac arrest, it is important to act quickly and call for emergency medical assistance immediately. The chances of survival are much higher if the person receives prompt medical attention. If you are trained in CPR, cardiopulmonary resuscitation, and have access to an automated external defibrillator, AED, you should provide CPR and use the AED to try to restart the person's heart. CPR involves pressing down on the person's chest with a steady rhythm to try to keep blood flowing to the vital organs, while an AED is a device that delivers a shock to the heart in an attempt to restore a normal heart rhythm. The survival rate for cardiac arrest varies depending on the circumstances of the event and the availability of medical care. In general, the survival rate is higher in cases where the person receives prompt medical attention and CPR. According to the American Heart Association, the survival rate for cardiac arrest outside of a hospital setting is about 10%. However, if CPR is performed within the first few minutes of the cardiac arrest, the chances of survival can increase to as much as 30%. It is important to note that a cardiac arrest is not the same thing as a heart attack. A heart attack occurs when the blood flow to the heart is blocked, while a cardiac arrest is caused by an electrical malfunction in the heart. However, a heart attack can sometimes lead to a cardiac arrest, so it is important to be aware of the symptoms of both conditions and seek medical attention immediately if you suspect either one. In conclusion, a cardiac arrest is a serious and often deadly medical emergency that requires prompt medical attention. It is characterized by the sudden loss of consciousness, no pulse or weak pulse, and no breathing or difficulty breathing. If you suspect someone is experiencing a cardiac arrest, call for emergency medical assistance immediately and provide CPR if you are trained. The chances of survival are higher if the person receives prompt medical attention and CPR. If you enjoy this content, don't forget to like and subscribe.